Well, Miss Bernard, your lab results have come back, but I still can't explain all of your symptoms. All that gross sputum you've been hawking up, the funny noises coming from your lungs, and those weird bumps sticking out of your chest. So I think I'm just going to cut you open, because I've never actually seen a real heart before.
Cut me open? Isn't there any other test you can do?
I'm afraid I don't know what else to do, and I've always wanted to cut somebody's chest open.
Are you crazy? You gotta be kidding me, right? Is there anything else you can do? I need a second opinion.
Okay, well, I think you're funny looking.
Not a second opinion from you, a second opinion from a doctor.
Okay, well, Dr. Brown thinks you're funny looking too.
I'm out of here.
Wait, doctor. There is another way to see inside her chest.
Who is that? Are you God?
No, I'm the voiceover guy. You should try some thoracic imaging.
Thoracic imaging? What's that?
Well, I'm glad you asked. Let's watch this short presentation about X-rays.
Ooh, X-rays are pretty cool. Let's do an X-ray.
That seems a little old-fashioned. Is there anything more modern we can do?
Well, I'm glad you asked that. Let's watch these short presentations on MRI and CT. X-ray computed tomography is a technology that uses computer-processed X-rays to produce tomographic images, which are slices of a specific area of the body. This allows doctors to see inside the object without cutting by generating a three-dimensional image from a series of two-dimensional images around a single axis of rotation. Its cross-sectional images are used for diagnostic and therapeutic purposes like this brain. X-ray slice data is generated using an X-ray source that rotates around the object. X-ray sensors are positioned on the opposite side of the circle from the X-ray source. An X-ray tube and detector are physically rotated behind a circular shroud. Newer machines permit continuous rotation with the patient to be imaged slowly and smoothly slid through the X-ray ring. These are called spiral CT machines. A subsequent development of the spiral CT was multi-slice CT. Instead of a single row of detectors, multiple rows of detectors are used effectively, capturing multiple cross-sections simultaneously. This is what it looks like inside that ring.
Okay. Hey, you gonna get a movie? Scene 1, take 5.
CT can be used for detecting both acute and chronic changes in the lung parenchyma. It is particularly relevant here because normal two-dimensional X-rays do not show such defects. For evaluation of chronic interstitial processes like emphysema, thin sections with high spatial frequency reconstructions are used. Often scans are performed both on inspiration and expiration. This special technique is called high-resolution CT and produces a sampling of the lung and not continuous images. This is a normal lung. This is a lung with emphysema. This is a lung with cancer. CT pulmonary angiogram is a medical diagnostic test used to diagnose pulmonary embolism. It uses computed tomography and an iodine-based contrast agent to obtain an image of the pulmonary arteries. Volume rendering and surface rendering are also used. Surface rendering is limited and then it will display only surfaces that meet a threshold density and will display only the surface that is closest to the imaginary viewer. In volume rendering, transparency, colors, and shading are used to allow a better representation of the volume to be shown in a single image. For example, the bones of the pelvis could be displayed as semi-transparent so that even at an oblique angle, one part of the image does not conceal the other. A threshold value of radio density is set by the operator. From this, a three-dimensional model can be constructed using edge detection image processing algorithms and displayed on the screen. Multiple models can be constructed from various thresholds, allowing different colors to represent each anatomical component such as bone, muscle, and cartilage. However, the interior structures of each element is not visible in this mode of operation.
Wow, that's amazeballs. Let's do both of those.
Good call. You might also want to consider an ultrasound.
No, I'm good. Let's just do an MRI.
No, we have to look at ultrasound. Mary Ann put a lot of hard time into this next presentation.
Okay, this is all pretty amazing stuff. I can only imagine what thoracic imaging looks like in the future.
That's a good point. Let's take a look at some emerging technology in thoracic imaging.
Ooh, well, Miss Bernard, it looks like I won't have to cut you open anymore since there's so many other options out there.
Yeah, there's X-ray, CT, MRI, all this cool stuff.
That's so awkward.
Okay, close up. Close up.